my name is Jocelyn Villarreal, and today I will be doing an examination of the ears, eyes, nose, and throat as a health assessment student. To start off, first and foremost, I would like to obtain the consent of my patient today, Eden Villarreal, if it's okay for me to obtain a recording of this assessment.
Yes.
Thank you. So the patient is a 24-year-old Hispanic male presenting to the clinic for a wellness checkup. He appears well-nourished, appropriately dressed for the weather, and is well-groomed. He is alert and oriented to time, place, and person, and appears to be without signs and symptoms of distress. He denies any food, medication, and environmental allergies. His vital signs have been collected and are as follows: blood pressure 112/72, heart rate 79, respiratory rate 19, temperature 98.6, and oxygen saturation at 100% on room air. So now that I have established that my patient is without distress, I can proceed on with his examination of the eyes. So we are going to start off by testing his general vision, and to do this I will be using a Rosenbaum chart positioned 14 inches away from the patient. So can you read with one eye covered? So let's go ahead and do your left eye first. Read the smallest line that you can on the chart.
LTFPH.
Okay, very good. So go ahead and do the same, but now with your right eye covered.
LTFPH.
Very good. And now go ahead and read the smallest line that you are able to with both eyes uncovered.
LTFPH.
Okay, very good. So the patient's visual acuity is 20/20 using the Snell and Tumbling chart on both eyes and each eye. We can move on and assess your visual field. So this will be a screening for that. And I'm going to stand in front of you, and you're going to let me know when you are able to see my fingers. Ready?
Now.
Okay, very good. So now go ahead and cover your right eye, and it will be the same procedure. Let me know when you are able to see my fingers here.
Now.
And then go ahead and cover your other eye.
Now.
Okay, very good. Now looking back to the chart here, are you able to identify the two colors on the chart? The color to the left
That would be red.
and the color to the right.
Green.
Very good. Start with the physical examination of the eye. So I've already put on my gloves for this portion of his exam. First and foremost, I want to look at the eyelashes on both eyes, and I can see that the hair is evenly distributed. None of the hairs are missing, and I don't see any crusting on the eyelashes. There's also no discolorations on the eyelid or around the eye. I don't see any lesions, and I don't see any masses. I'm also going to be taking a look at the lacrimal apparatus, which is the inner corner of the eye here, for any tearing or swelling of the inner corner of the eye, but I can see that you don't have that. This is sometimes present in people with allergies. Next, I'm going to be looking at the conjunctiva and the sclera. So for this, I'm going to ask you to look up and down and then side to side. So let's start off with your right eye, and down, side to side, and I will do that with the upper eyelid as well. Go ahead and look down, up, side to side, and I can see that the conjunctiva is clear, the sclera looks white. There's no lesions or redness or discharge noted. So let me do the same, but now on your left eye, look up, down, and side to side. The same with your upper eyelid, up, down, side to side. So I am looking again for any discharge, any lesions, or any redness in the eye. But on your left eye, the conjunctiva was clear and the sclera was white as well. So I'm looking for the signs or symptoms that can be caused by any exposure to any environmental allergen, any chemical exposure, and any kind of infection in the eye. So next I'm going to be doing what's called a lateral pen light test. And first I'm going to be checking your cornea, your lenses for any opacities which can signal injury or infection or certain eye diseases. And doing the same test, I will be checking your irises. And I can see that the light is reflected all across the eye, which this test is used to assess for an increase in ocular pressure, which is a sign of glaucoma. And if the light does not fluoresce across the entire eye, it can be a symptom of this disease. The cornea and lenses were also clear without any opacities or any signs of injury or infection. So now I'll be moving on and doing a pupillary eye exam. I can see that the pupils are normal in size and bright light, so 3 millimeters. They are symmetrical. And for this, I'm going to go ahead and dim the lighting. I'm going to go ahead and have you focus on an object across the room first, and I will be shining a light into each pupil. So I can see that the size constricts to about 2 millimeters with direct illumination, and I'm going to go ahead and do it again. And this does cause the other pupil to constrict, so this is testing for consensual reaction. Again, I'm going to have you focus on a distant object across the room, and then focus on the pen, and keep your focus on the pen. And both eyes turn inward, indicating convergence, and both pupils constrict. So both of these functions are needed for binocular vision. So now standing about 2 feet away from the patient, I'll be testing your corneal light reflexes. And for this, just keep your eye on the light here. Okay, very good. So now I will be testing your extraocular muscles, or the 6 cardinal fields of gaze. And for this, I'm going to have you keep your eyes on my fingers. Okay, thank you. So I can see that the extraocular movements are intact without any signs of nystagmus, ptosis, or lid lag. So now I'm going to have you cover your right eye, and I'm going to check for the positioning of the eye. And go ahead and uncover, and then cover your left. Uncover. Very good. Okay, so I don't see any deviation of each eye. The next test will be an inversion of the lid. Okay, and it appears pink and moist without any lesions or signs of trauma. I'm going to do your right eye. And the right upper eyelid and conjunctiva appear pink and moist without any signs of lesions as well. Alright, so now moving on to the fundoscopic exam. I have dimmed the lights for this portion of your eye exam, and I will be using an ophthalmoscope to look into the eye. Alright. So first I am going to identify your red light reflex here. Once I visualize it, I'm going to go in. And I'm going to do the same on your left eye. Back on. What I was was able to visualize was the red reflex. It is intact in both eyes and symmetric. If I were not able to visualize the red light reflex, this could be indicative of retinal diseases such as cataracts. Additionally, his optic discs were pink-orange in color. They were oval vertically in both eyes with sharp margins. There wasn't any papilledema, which is a sign of glaucoma, and they were also symmetric in both eyes. The retinal background was even in color without any hemorrhages or exudates. And lastly, the fovea and the macula were also free from exudates, hemorrhages, or cysts, which can also be indicative of certain retinal diseases. Another thing I wanted to mention was for the inspection portion, we are also looking at the positioning and symmetry of the eyelids, because any drooping of the eye could be indicative of a neurological condition such as facial paralysis or stroke. So now our eye examination is complete and we can move on to an examination of the ear. So the first thing I'm going to be inspecting is your external ear, and here I am looking for any deformities or masses and the symmetry of the ear compared to the skull. So let me take a look of your right ear here and the back. And I'm also going to be palpating the ear here in front of the ear. And does this elicit any tenderness or pain?
No.
And the external ear or auricle is free from masses and free from tenderness. So this could be a sign of an ongoing infection. And then your left ear here. And I don't see any deformities of the ear. I'm not feeling any masses, and the ears do look symmetric to the positioning in your head. Did you also have any tenderness of your left ear? No. Okay, good. So now I will be doing what's called a gross auditory acuity test to check for your hearing, and I'm going to be doing what is called a finger rub test. So I'm going to rub my finger on each ear while you occlude the opposite ear, and I'm going to repeat the test with both ears unoccluded. So let's go ahead and start by testing your left ear, and for this I'm going to ask you to occlude the right ear and press down here on the tragus. And let me know if you hear it.
I hear.
Okay, let's do the same but on your right ear.
I hear it.
And now with both ears unoccluded. And do you hear it on one side louder than the other?
No.
Okay, very good. So again, this is to test for any kind of hearing loss. So next we can move on to do an otoscopic exam with an otoscope here. So I will be taking a look at each of your ears, okay? So let's start with your right ear. And the first thing I'm going to be looking at is your ear canal. I'm going to be pulling your ear up and back. So I can see that there is mild cerumen, but the ear canal is free from foreign bodies, discharge, or erythema. If there were any kind of drainage, we would be looking at something like otitis media with effusion, which is an ear infection. And I will be doing the same with your left ear, pulling the ear up and back. And this ear canal also is free from any foreign bodies, has mild cerumen, no erythema, drainage or swelling. The tympanic membranes are pearly gray in color. The cone of light is at 7 o'clock, and the tympanic membranes are not bulging, retracting, and I don't notice any perforations. The following test is called pneumatic otoscopy, which according to the Golick textbook is the method of examining the middle ear by using an otoscope that has an attached rubber ball to it, and this is used to change the pressure in the ear canal. So the clinician can do this exam to determine whether or not the tympanic membrane moves. If the tympanic membrane or the middle ear is well aerated, the tympanic membrane should move according to the pressure that is exerted in the ear canal. Next, we will be doing a couple of special tests to assess for hearing loss. The first one is called the Weber test, and I will place the tuning fork in the midline of the scalp, and you let me know if you hear the sound more on the left or more on your right ear or on both ears equally.
Both ears.
Equally?
Mm-hmm.
Okay, very good. Unilateral conductive hearing loss, the patient would have heard the ringing more so on the affected ear, and the opposite is true for sensory neural hearing loss. So the following test will also be done to assess for hearing loss. It's called the Rhine test. And for this, I'm going to place a tuning fork behind your ear on your mastoid process or your mastoid bone there, and let me know when you can no longer hear the sound, and I will bring the tuning fork alongside your ear. So let's go ahead and start on the right side. Okay, so I will be doing the same but now on your left ear. Okay, great. So the patient did hear the sound 2 times louder when the tuning fork was next to his ear on both ears, which indicates that air conduction is greater than bone conduction. So this is a normal exam finding, and if bone conduction were greater than air conduction, this is indicative of conductive hearing loss. Alright, so that concludes with our examination for the ear. So now we can move on to the examination of the nose. So first and foremost, I want to start off by inspecting the nose for any lesions, any deformities, and I'm checking that the nose is midline, which it is, and I don't see any deformities or lesions on or around the nose. I am palpating here for any masses, and also to check for any tenderness here. Is there any pain?
No.
So next, I'm going to be checking the patency of each nair. I'm going to have you first go ahead and occlude your left nair and take a breath as you would normally. Very good. Do the same on the right side. Okay, so the nairs do appear to be patent. I would also like to palpate your sinuses here and let me know if there's any pain or tenderness in this area here and here.
No.
And here I'm checking for any tenderness, which can be indicative of sinus congestion or sinusitis. At this time, I would like to do a trans-illumination of the sinuses here. So I'm going to shine the light into the sinus and look for the light at the roof of the mouth, and I'm expecting to see that light. If I don't see it, again, this could be an indication of congestion in the sinuses or sinusitis. Go ahead and open your mouth, and I see it at the roof of the mouth. Very good. Alright, so now I would like to inspect within the nose. Using my otoscope here with a new cap. And I'm going to be inspecting both nairs. So after having inspected the nose, I could see that the nasal tubernates were non-erythemus and Edematous on both nares bilaterally without any signs of drainage. The mucosa is moist and pink without any bleeding, exudates or polyps. Nasal polyps can be seen in patients who have chronic allergic rhinitis, allergic fungal sinusitis, or cystic fibrosis, but I didn't notice any in you. Also, the septum appears midline without any deviation or inflammation or perforation. So we would see septal deviation or deviated septum in patients who have had trauma to the nose or any surgical manipulation to the nose. So moving on to the assessment of the mouth and the pharynx. Upon inspection, I see that your lips are pink and moist without any lesions, wounds, and the lips are symmetric. So symmetry is very important factor to look at because, again, just like the eyelid drooping, it can be indicative of a neurological condition, so facial paralysis or stroke. But the lips do look symmetric and I don't see any lesions. Also, especially any ulceration or lesions around the lips that are non-healing can be indicative of cancer. So next I'm going to be checking your oral mucosa. I'm going to have you open your mouth for this exam. The oral mucosa is moist and pink without any signs of lesions or ulcerations, which again can be indicative of oral cancer. And I'm looking at the gum line, looking for any retraction or signs of periodontal disease, but the gums look pink, non-inflamed, and non-ulcerated. I'll also be taking a look at the top of the mouth. And I'm going to be assessing the teeth. And I'm going to see if any are loose. Open up. Alright, so first and foremost, I'd like to say that the gums are pink, non-inflamed, without any bleeding, like I said, or ulceration or retraction, all of which can be a sign of periodontal disease, but it looks like you have good oral hygiene. The teeth, the patient also has all dentition intact without any loose teeth and without any caries. Also, I can see that the hard palate is also free from ulcerations and it is moist. Now I'm going to be checking the soft palate here. So for this, I'm going to have you say ah. And I can see that the uvula is midline and the soft palate elevates when the patient says ah. Any deviation in the uvula can indicate peritonsillar abscess. And again, I'm going to be checking your tonsils at this time, so take your tongue out for me. And the tonsils are non-inflamed without any exudates or white patches, which could be tonsillar cysts. They are 1+ in size. And our last step for this is going to be checking the tongue. So I'm going to grab the tongue with the gauze here. And I'm inspecting again for the color of the tongue, any lesions or ulcerations here. And I'm now going to look under your tongue. And I'm particularly here looking for any kind of induration, which is very common in oral cancers, or people at risk for oral cancer, such as tobacco users. And lastly, I want to check for any induration of the tongue here. I also don't feel, like I said, any indurations of the tongue. Thank you for your cooperation. I didn't see any ulcerations. The tongue is pink in color. And lastly, there is no pooling of saliva under the tongue, which once again can be a sign of cancer. So that concludes our examination.